We want Chahal sir to be in the center. We want Chahal sir in the Namaskar, everybody. And we have with us today a very, very special guest. His name is none other than Mr. Shri IQBAL Singh Chahal. Uh, he is the man who is behind the Chase the Virus campaign in Mumbai. And I am going to give you a little personal glimpse. And we are grateful to you, sir, that you have joined us on this Facebook Live session, which we have been conducted with millions of viewers, not only from India, but more than 100 countries across the world. Mr. Chahal is a honor student from the beginning. He was a CBSE All India Merit Rank holder from New Delhi. He has been a B in electronics and electrical engineering. So he's an engineering par excellence, but decided to switch gears and not join the corporate world, but serve his motherland, India. And currently he is the commissioner of the Mumbai Municipal Greater Corporation. Prior to that, he has had an extensive experience and is very worthy of this job. He started his career from pockets of tribal health and malnutrition from Nandurbar, from Nashik. And from there, very gradually, step by step, he built his career. He has served in Nashik, in Aurangabad, he was the CEO of the Dharavi redevelopment project. He has been a part of the urban planning. He also has been gone to deputation to the Department of Home, Government of India. He went to Hyderabad, where he started the e-governance. And actually the first Setu, he has a huge role in that e-governance, and he got a national award way back in 2002. 18 years back, he had an e-governance Setu. Today we have Arogya Setu, but one of the foundation stones was laid by Mr. Chahal. He knows Mumbai inside out because of his experience in urban planning, because of his experience with MADA, because of his experience with Dharavi redevelopment project, and he's a fine administrator. But he had another facet to him. He was also the secretary for the medical education and drugs department. So he knew medical colleges. So he knew health, he knew the urban slums, he knew the city, he knew administration, he knew e-governance. And he has not only lectured in India, he has lectured with the Harvard University, he has lectured with UC Berkeley last year, and he is a hardcore administrator with a heart. But not only that, he is a fitness freak. From 2004, every year, he has ran the marathon. And right now, he is running the marathon for India and for the world. Because Mumbai has more cases. Mumbai has more cases than whole of China put together, whole of probably Europe put together. And he is the man of the moment. He is the man who has changed the face of Mumbai, Bruhan Mumbai Municipal Corporation. He was got in the midst of the pandemic at a crisis, and he's a Mr. Crisis man. But he's very humble at heart. He's a 24/7 person, and I welcome you, sir. I know there are a lot of your facets which we have not discussed here, and as we discussed today, we would like you to first ask you a very simple question, sir. How did you accept this challenge? Because it is not easy. You know, it is like when you were given this post, many people said, "Arey baap re, ye to abhi fas gaya." So how did you accept this challenge? Because you were an outstanding student, you're an outstanding sportsman, and you knew that you were not getting into something which is easy to get out. And not only you accepted this challenge, but you have faced it bravely. So from a personal standpoint, what were the feelings of you and your family when you were given this task to lead Mumbai, sir?
Sir, actually, when from 2013 to 16, I was working with Government of India, and I was working as OSD, the Union Home Minister. And after that stint in Home Ministry, I was looking after Union Territories also as JSUTs, which looks after the Delhi government also and all the Union Territories of India. When I came back, then Honorable CM, Mr. Devendra Fadnavis, he put me as Principal Secretary in the Irrigation Department, which was that time scam-ridden, and the department was line closed because of huge 70,000 crore alleged scam there. And we had contractors and engineers in jails that time. So nobody was really willing to accept that assignment. Since I came from Delhi, I was put into that. But I'm happy to say that not only we got past, we could offload past baggage, we built 162 dams, investing 62,000 crore rupees in the last 4.5 years before I came here. And we got the National Water Award for Irrigation Department Maharashtra, which is like a Bharat Ratna for Irrigation Department. So this was a journey from a scam-ridden department to the best department in the country in irrigation sector. And having finished, completed that, when I joined, I had more than 300 irrigation projects incomplete. So we got a lot of funds from Government of India, the Honorable PMO's office, and we could actually remove 162 dams from the budget head and complete them. And another 50 dams are on the verge of getting completed. So we were awarded with the National Water Award by the Government of India. And when the new government came to power, I was picked up to be the Principal Secretary Urban Development in the month of February. So I joined as Principal Secretary Urban Development, and but there was a lot of insistence from the Honorable Irrigation Minister that I should continue there also. Despite having done more than 4 years in Irrigation Department, my longest ever Irrigation Secretary in the history of Maharashtra State. So from February to May, I was holding both the charges. I continued with the irrigation, and I became Principal Secretary Urban Development also. But on the 8th of May, suddenly I got a call from Honorable Chief Minister, and he said, Chahal, we are putting you into Bombay Municipal Corporation today, and you should join in the evening. And I very humbly said, sir, I assure you that I'll try my best. And I salute my Honorable CM. You know what he told me? He said, Chahal, if the municipal commissioner, MCGM is in a terrible mess, Mumbai is getting a lot of cases. We are getting a lot of calls from Government of India about the situation in Mumbai. Everybody is worried. He said, if you succeed, success will be yours. Look at the greatness of Honorable CM. I salute him. He said, if there's a failure, it will be my failure. So that one single statement literally put life into me, it energized me. I decided that come what may, I'll risk my life also. But for such a great man who says that success is yours, failure is mine. Otherwise, many of the CMs would say, failure is yours and success is mine. But here, it was the opposite. Honorable CM said, it will be my failure and your success if you succeed. So I decided, I joined at 7 p.m. on 8th of May, had 5-hour-long meeting that night, and early morning, I was in PP kits visiting ICUs of KM Hospital, Nair Hospital, and Dharavi slums. And from there, the momentum started. And we don't have a choice. We are just ordered to go to a department, and we, as a soldiers, we just go and join there.
I think you shared what Abdul Kalam was told by his senior when the missile went down.
His mics are on. We could, if we could close other mics, then it will be more clear voice.
Anirudh. I think what is important is Abdul Kalam also had the same experience. When the missile fell into the sea, his boss gave an interview and said, "I take the responsibility." And when in the next experiment, the missile actually hit what it could. And Abdul Kalam, I mean, that's an anecdote which I remember. Sir, you have done something very fascinating, and the fascinating part is you have decentralized the action for the COVID virus, and you said ward is the cornerstone of the activity. And,
yes,
and that was very surprising, and you may have had a lot of thought behind this. It could be accountability, responsibility, and power to the ward. Why did you do this, sir? And what is the experience? Any stories?
Yeah, there are two reasons for that. When I joined on 8th of May, the first 15 days were so terrible that every evening around 6 p.m. we would get a line list of about 1,500 plus positive patients from the various labs. And the lab would send a very crude SMS message to the patient that you are positive, full stop. The patient would get a small heart attack when he would read that SMS, and then he would start ringing up his friends who are in positions of power. They might be IAS officers, they may be senior doctors, they may be politicians, and telling them to arrange a bed for him. Because he would start imagining that something worse may happen to him. For those days, people would think that once you are positive, you may die also. So now this 1,500 patients would generate 15,000 phone calls to one central control room between 6 and 8 p.m. And our lines would collapse, 30 lines. And then all media channels, everybody's various stakeholders, they will start saying that the beds are finished. There's no bed available in Mumbai. The lines are down. And I would start getting calls from the union government, from the Home Secretary's office, the Cabinet Secretary's office, that Chahal has the beds exhausted. You don't have beds. Your lines are down. So it was very embarrassing. And I would also think that, look, people would die like this, and unless we do something very seriously, some serious business has to be done. And secondly, I am a team man. Whether it was irrigation department, whether it's home ministry, I always believe that a capable team is 1,000 times better than a capable man. And I had full trust in this team. So that is from where my senior officer told me, sir, let us increase the lines of our control room, central control room, from 30 to 60. I nodded, but I knew that this is not going to work. If 30 lines are made 60 lines, again 15,000 phone calls are going to come. So I decided that unless there is a major surgery done, this problem of bed confusion and people dying without getting a bed and people roaming from one hospital to another hospital immediately struck me that let us create a decentralized system where the burden gets decentralized and divided amongst 24 wards. So I told my team, I said, let one ward be like a one Mumbai for the citizen. So there we decided that let us have 24 war rooms. And these 24 wards, which are very well established for the last 70, 80 years, it's an established institution. It is not like new institution I'm creating. And then I needed a lot of doctors for that. Now, how to find maybe 10 doctors for one ward and suddenly 240 doctors in 3 shifts, you need 600, 700 doctors. From where do I get doctors to man these wards? So we started SMS campaign, WhatsApp campaign, and a newspaper advertisement. Because I was Secretary of Medical Education. I knew Maharashtra has more than 50 medical colleges, private and public put together. And each medical college has about 200 batch in every professional. So I knew this third professional students who are interns, and they are more than 10,000 in Maharashtra. And these young boys, 21, 22, 23, they're sitting homes doing nothing. So I said, we reached out to them. We said, look, you are getting only 11,000 stipend for your internship. I'll give you 50,000 rupees, 50,000, 500%, and a free stay in a 4-star or 5-star hotel in Mumbai. If you come from rural Maharashtra and join me, you'll be shocked that I had 800 people asking to come here. And that is how then we told Dr. Mohan Joshi, our Dean of Nair Hospital, to take the training. So we took the training in batches, and that is how we put hundreds of these doctors in the war rooms to manage. And these young boys and girls are so enthusiastic. They are, first of all, they are comfortable staying. They have complimentary stay. They stay free of cost in a 5-star hotel or 4-star hotel, and they get handsome 50,000 rupees a month. And now they started managing these war rooms. Second, we were short of ambulances. So I took 500, I went to election mode because I have conducted 8 Vidhan Sabha and Lok Sabha elections as collector. So there we need hundreds of ambulances. So in one single day, I told State Transport Commission, please give me 500 Novas. And the moment they came to me in just about 72 hours, I put them in my workshop. We just put one aluminum sheet between driver's compartment and rest of the vehicle. And we put 1 week's advance quota of PPE kits under the driver's seat. I told the driver that you have a separate compartment, but if still you feel that like you're unsafe, you have PPE kits, 7 PPE kits in advance with you. Suddenly we have 500 ambulances. We started working. We had mini buses of BEST. We converted 60 of them into stretchers ambulances. And now then we parked 10 ambulances in this 24 wards, 240. And we put 10 medical teams in these 24 wards. So each ward became 24/7, self-equipped with doctors, with telephone operators, with ambulances, with medical teams. And then I went to online IT experts. And we got dashboard made. We put 145 hospitals beds on the dashboard. And then I had a series of meetings with these lab people. I said, I must get every report in 24 hours. Otherwise, your shop will not function in Mumbai. And this is what the ICMAR says. It is not my direction, it is ICMAR's directions. I'm just trying to implement those. And I said, let your line list come to me at midnight, 12 o'clock, when everybody's sleeping. And no direct business of sending these crude messages to the patients and making them mentally uneasy. So we get line list at midnight. By 6 a.m., our teams are working and we clean the list of duplicate names or some people who are fit for discharge, their testings like that. And by 7:30, the computer automatically splits them into 24 parts depending on the addresses, and they appear on dashboards of these war rooms. So if I have a list of 1,500 divided by 24 wards, each war room gets 60 names, and there are 10 dashboards, so each dashboard gets 6 names only. Out of 6 names, there are 4 names who are asymptomatic. So doctors start calling them at 8 a.m. and each dashboard has to allot only 2 beds. Once he allots 2 beds, 1,500 people are disposed of by 12 o'clock. So this has really worked very well. And in fact, I was threatened by an opposition leader. He said that if you are dismantling control room during middle of the war, and if your war rooms fail, there will be utter chaos. But I told him, I said, you wait for 15 days and see. I said, time will tell what is going to happen. And for the 8th of June, we started that. And today is 25th of July. So in the last about 50 days, he hasn't called me again.
So congratulations, sir. You have
Yes.
been truly outstanding. But as you started combating Corona, you know what happened is Cyclone threatened Mumbai and monsoon came in. So how
Yes, sir,
have you
one-
been able to
one-
handle the double
Yes, sir.
whammy of cyclone and monsoon?
You know what happened that on the 1st of June, IMD told me that there is a cyclone coming to Mumbai after 129 years. And I said, oh God, we have so much a problem at hand, because I was just 22 days old that time on my seat. And the IMD told me that last week when the cyclone came in Kolkata, last 7 days there is no electricity in Kolkata town. And they said that I was wondering that if the same thing happens to Mumbai, not only thousands of people may die in that 220 km/h per speed, wind speed velocity, and my hospitals may go out of electricity. So I took so many Zoom meetings from first and second whole day. I must be on the Zoom for 16, 17 hours talking to deans, ward officers, other stakeholders that we have generator backups for ICUs, how many hours they can last, whether we have diesel for them. So all minor things were getting planned for those 2 days. And then I had 218 patients in BKC Jumbo Hospital in Bandra. I discussed with Honorable CM, and the Honorable CM rightly advised me. He said, Chahal, you must remove all these patients to a more safer place like a dome or hospital, because these structures were certified for 105 km/h speed when they were constructed. And we were being threatened by the speed of 230 km/h of like cyclone speed. So it would have blown the roofs out of these hospitals. And on second evening at 8:30, IMD told me that the cyclone is 50 kilometers away and is going to hit Mumbai now. And they say that like this cyclone is moving at 5 km/h. And it is sucking in a lot of air now, and then it will become a furious thing. And whole night we were very worried. We were scared. I told Honorable CM, I said, sir, tomorrow morning, right from commissioner to all 100,000 people of DMCs, we'll be all on the roads. Come what may, and we'll do our best. And I had told all my ward officers on the Zoom. I said, tomorrow morning 8 a.m. even we get blown away, we have to be on the road. So, and we had put squads of 20 people with cutters and other equipment and vehicles in every police station, every ward room, that if there are big hoardings which fall down or trees which obstruct the main arteries of the city, they should be cleared immediately, because otherwise the rescue teams, NDR won't be able to move only. And I was expecting a huge havoc, but in the morning, at 6 a.m., again I rang up IMD people. They said, there's a little good news for you. The cyclone has got a little down towards Raigad side. But ultimately, God was kind. It went 130 kilometers away from us, and we got saved. So, and that day, my resolve became even stronger. I said, there's a divine presence now. And even God is helping me. So I must now develop my efforts.
Dr. Shetty, sir.
As you said, Kargil was won by the young officers in the 20s. And similarly, the war against the virus is being fought by young doctors who are daring to go. And so many doctors have really praised the efforts of BKC. So there's something new happening with the virus, and Dr. Shashank also is aware of that. Virus is traveling from South Mumbai to North Mumbai, and my place, Andheri East and Vilepa K East and Kandivali, Malad. And are there any plans as far as the MCGM is concerned to look into this and break this down at the earliest?
There is one thing which I would like to bring to the kind notice all the eminent citizens, especially Mumbai citizens, that a major change has happened. A general perception is that 1,000, 1,200, 1,400 cases are coming every day now also, and they were coming 1 month back also, and they were coming 2 months back also. What is the big thing which is difference happened? But let me explain that from 13th of May, ICMR guidelines came, which we implemented on 13th of May, they came on 11th of May. They said that the flu clinics and the people, RMPs giving prescription, they shall prescribe only symptomatic cases. And we prepared a pro forma, where a flu clinic doctor had to certify and sign that I am hereby recommending swab of a symptomatic patient only. And so what was happening, that we were sending about 4,000 samples every day, sometimes 3,600, 3,700, and almost 1,300, 1,400, 1,500, almost 40% were coming positive, which means all these 1,500 would need hospital beds because they're all symptomatic only. But today, after we scrapped prescriptions on 3rd of July, we are getting about 1,000, 1,200 cases every day. Like yesterday I had 1,051, today I have 1,070, 1070. But you'll be happy to know that out of the 1070, almost 85% are asymptomatic, which means I just need 150 hospital beds against 1,500 hospital beds which I needed that time. Although the list looks to be the same, but this is a major change where the requirement of beds have come down for almost 1,500 beds a day to maybe 200, not more than 200 beds a day, sometimes 110, 120 beds a day. And this is something which doesn't come out to clear a perception, but against 1,500 hospital admissions, which is happening a month back, today we have never had more than 200 hospital admissions. This has, on one side, taken away a lot of load from the doctors, and that is why we have 7,100 beds lying empty in hospitals today, where you have oxygen facilities, where you have ICUs, which are regular hospitals. They are not quarantine centers, they are not COVID care centers, they are actual hospitals with all the facilities and expert doctors there. There we have now 7,100 hospital beds lying vacant. This is the difference between that list of 1,500 or 1,400, 1,200 and today's list of 1,000 or 1,200. And now another thing, that list of 1,500 was generated by, say, 3,700, 3,800 positive cases. Today's list of 1,000 is generated by 7,600 tests. Like today morning, Mumbai had 7,600 tests, and almost all of them RT-PCR. Delhi is doing only about 5,000 RT-PCR. They are adding their antigen and antibody tests and then saying that we are doing 18,000. But we have never clubbed our antigen and antibody tests. We are saying this is our RT-PCR hardcore thing. So today morning it is 7,600 tests, and still we have 1,000 cases only. So which means like only 1/7 of the cases coming positive now, which was 1/3 a month back. And out of this 1,000 also, if you see, symptomatic is less than today it is about 170. So out of 7,600, we only 170 people fit to go to hospital. And in a city of 20 million, 2 crore, if there is a 170 hospital admission in a day, let people decide or judge what is the level or intensity or the gravity of the situation.
Wonderful, sir. Wonderful. You have been truly outstanding, sir. And we want to know from you, sir, what is your advice to the citizens of the world? Because Mumbai has led this fight of corona, chasing the virus via you. So what would you advise the citizens of the world how should you handle corona? Because you have a complete experience from being an administrator to being help of one of the most populated cities on planet Earth. What is your advice to the citizens of the Earth?
Sir, I would say that basically the fight against COVID is standing on four pillars. The first pillar is the testing lab and regime. The second pillar is the ambulances, which we have more than 750 ambulances today in Mumbai. I had only 80 when I joined. Third, it is the hospital infrastructure, and the most important, the doctors and the experts. These are four pillars, and we have basically 5 tools or weapons to fight this war. First is aggressive testing. Second is contact tracing. Then third is the contact tracking, and fourth is quarantining people, especially from slums, to cut their connection from the virus infested areas. And fifth is treatment. Now, lot of debate world over is basically going on vaccine. And everybody is talking about remdesivir or tocilizumab or favipiravir. So if everybody is talking about the last stage. But in Mumbai, what we did is we did tremendous focus on surveillance and home-to-home visit. You'll be surprised that today morning when I'm talking to you, 1.71 crore people in Mumbai have been visited and surveyed at home in the last, say, 110 days. 1.71 crore. We have actually reached them. And once we do the surveillance, especially 68% people in Mumbai live in slums, which is more than 10 million population in slums, 12 million. So when we were visiting them house to house through our 8,000 strong MOH staff, through NGOs, through other efforts, now we picked up a lot of people who were unwell, and we took them out, we tested them. Our testing was very focused because we were testing only suspected people. And after, because of surveillance, lot of these people were taken out, especially symptomatic, and they were put in hospitals. Initially, we had very high mortality rate, but now that is slowly becoming comfortable. The surveillance thing and house-to-house visit, and that is why when I joined, I said this 100,000 people working in MCGM, unless they all are in the field, these wars cannot be fought from air-conditioned rooms. That is why I decided to visit one slum after another slum. And visiting a slum or a containment zone would mean walk of several kilometers, minimum 4 to 5 kilometer walk in the containment zone. And suddenly I found that thousands of my employees started getting into slums. I would say at a time, we would have 40,000, 50,000 people in the slum on a particular day. Our class 3, class 4, sweepers, then our medical staff, then our ward officers. So that changed the entire scenario of the situation. Now, we never focused on vaccine and treatment. We more focused on basically tracing them, chasing the virus. Wherever you get a positive person, you take 15 high-risk contacts, you lift them up compulsorily, put them in government quarantine, don't leave them behind to disconnect from the virus. This was more important because had we not taken out this lakhs of people from their existing environment of slum into a government quarantine, institutional quarantine, thousands of them would have become positive. And they would have in turn made another tens of thousands positive. This change would have become massive and very dangerous. So if we took out, say, 100,000 people out of slums, basically we prevented 1 million people from getting infected. We basically worked on the basics rather than waiting for the vaccine or rather than waiting for expensive medicine to come. Whereas what is happening in most of the advanced countries, like even in US today, even if you have got a fever, you are unwell, you have symptoms. Like I have a lot of relatives in America, so they tell me that even if you go visit these doctors, you are told to come after 8 days. They say the virus will be tested after 8th day, on day 8. Even if you have 104 temperature, if you are unwell, if you have got cough, you are told to stay home. And then 8th day is the time when you get tested. And my cousins in America say that it sometimes takes 10 days to get tested there in America, because they once you get tested, then they
And the
become
report comes after 5 days.
yeah, and a report comes in 5 days. And once you are positive after 8th, 9th or 10th day, then suddenly they keep giving you medicines. So maybe they don't have so many human hands or medical staff to visit them home to home. So this is the basic difference.
Thank you, sir. Dr. Shetty?
Absolutely, I think the war is fought on the front foot and not on the back foot. You're hitting strokes straight over mid-on and mid-off. Sir, BMC is heavily unionized. And how did you dialogue with different sectors of the BMC and saw to it that they moved ahead with the vigor and vision which you have? The second question is, we are all perturbed by the by at least one of the five people on the streets even today not wearing the mask, taking the COVID head on without the mask. You are an experienced man who has worked with different populations across the country. What are your answers to these two small questions, sir?
No, sir, when I joined, I took number of meetings, in fact, like physical meetings. The first meeting of more than 100 people, which included 24 ward officers, 24 wards, 24 medical officers, 40, 50 heads of department. I said, let at the cost of risk, I must have physical meetings with them, not on the Zoom. I said, unless I sit with them and look into the eyes and we have eyeball contact, and I really, till that time, things are not going to work. So first 4-5 days, I met maybe 500 of my people physically in my meeting halls. I was not scared that I will get you on the Zoom, because somehow I like physical meetings. I've been a field man. Because unless you look into the eyes of man and get a commitment from him, things don't move. So I told, first thing I told my team was, I said epidemics happen once in 100 years. And it happened once in generations. I said, look at how fortunate we are. God has picked up us for this noble cause, to serve humanity. And don't treat this as a posting or tenure. We must be on a mission. We should on a mission to serve humanity, because we are the blessed ones and we are the chosen ones whom God has picked up to serve humanity. And these opportunities don't come to everybody. So such motivational lectures also galvanize the staff. And then I told them that, look, I will stand firmly behind you, but you must deliver. And then my punchline was, I said, on the first day when I took 5-hour-long meeting, I said, the only mantra is perform or perish. And that applies to commissioner also, not to you alone. I said, if we don't deliver in the next, say, 1 month, including me, everybody, the concerned person has to perish. And if you think, and then I told them, I said, if you think that I am putting to risk and you can't risk your life, then please tell me right away who all are comorbid, or who all are too old, or who all are too scared. You give me your names, in 24 hours, I'll make sure that you are replaced. There's no compulsion. But whoever is there on the seat, he has to perform. And he has to take us his mission. Don't behave like an assistant commissioner, or maybe I behave as commissioner. We should behave as soldiers, all of us. And that is how we are going to deliver. And that exactly is what happened.
Great, sir. Outstanding, sir. So I want to share a personal anecdote. Okay, go ahead, Dr. Shetty.
Yeah, the masks, the people are very concerned that 1 out of 5 Mumbaikars are not wearing masks on the road. What should we do about it, sir? How do we change the situation? Even Mamta Asthana has been asking that question. Citizen groups. Yes. How can they empower people to wear a mask? Yeah.
Sir, this is so important. Social now, the new normal is a top class, a top level of social discipline. Because unless you have the discipline, things cannot be comfortable in the longer run. I always tell people, I said, if you develop a habit that you will wear mask the moment you step out of your flat or house, and you don't touch your hands, you don't touch your face with your hands, and you maintain little social distance of maybe 1 meter, I can assure you that you will not get COVID. But that discipline has to be like a military discipline. It means if I don't touch my face, I won't touch my face even in 24 hours, even once when I'm out of the house. So, but wearing a mask is so important because accidentally it is human nature that you touch your face 20 times in a minute. So when mask is there, automatically there is a natural protection of your hands touching your nose or your mouth, which is the most vulnerable area for the virus to enter. So I would request all the citizens of the country, especially Mumbai, with folded hands, that if you just wear mask only, you will not only save yourself, you will save your family, your relative, because if one person in the family gets positive, he may infect the entire family in the next few hours, and one of them must then have die, because ultimately this virus is going to be funny with one of them. Others may survive. So in the interest of our own family, our own elders, our own children, we should wear masks in the interest of our family, not in the interest of the government.
Very true, sir. Very true. So in fact, I wanted to share a similar episode of our Honorable Municipal Commissioner. Once, I was one of the meetings which he was attending and leading on reducing mortality and saving lives of Mumbai in the hospitals of Mumbai. And he addressed to all the top deans, the professors, and told them very nicely that treat every patient like your own mother and father, like your own children. And those motivating words and the human touch which you get, Mr. Chahal, how did you learn to adapt that? And what were your strategies to save lives in Mumbai? Because now we have ensured that the pandemic is under control. Most people are now getting, but the number of lives we are still losing was large. And I think that was a bugbear, I think. And that's how I connected with Honorable Chahal sir. And we have got a little bond between us that, he's so committed. He told every person in that meeting that, and they were all top doctors, top officials of the government, that treat everybody like your own father and mother. And I think those words echoed with me. And that's exactly what he's telling all of us here, that treat yourself as a family, don't do it for the government. But sir, saving lives is still our mission. And we still are committed to getting that below 1% number. So how did you handle that, sir? Because that was very high when you got the seat, when you were put on the hot seat. And you had another bugbear that, there were a lot of unreported deaths. And those two bugbears, how did you solve them? And how did you continue this mission? Because it's not an easy mission. And because probably you are a marathoner and you're a marathoner par excellence, you are in different stages of the marathon, but you have never given up your commitment, your focus, your zeal and compassion, and you're still very cool, very calm. You never lose your cool, and you always have a human touch to it. So, sir, saving lives, sir.
Sir, initially when this pandemic came in March, and we had the first lockdown in Maharashtra, 21st of March, 22nd was the Janta curfew, and then 24th onward, the huge lockdown came in. We had only 2 labs in the state of Maharashtra, including Mumbai, for 12 crore people. And lab reports would come after 15 days, 20 days. And we had so many cases where somebody's swab was taken and he was positive and he passed away before his result could come. Not only that, even his high-risk contact passed away before his result could come. So that led to a lot of mortality all over the country, all over the world, I would say. And now people keep on comparing our mortality rates of Mumbai, but the real fact is that on 6th of June, one major hospital in Mumbai reported 17 deaths in their format. And I was shocked. I said, how can 17 people die in one hospital in one day? Normally, hospital ICU have more than about 15, 20 rooms only. So, in that case, when I went a little deep into that, I found that there's only one death that day, and 16 deaths were reported of March, April, May, on 6th of June. Then I immediately realized that this is true. This may be true for hundreds of hospitals in Mumbai, because when the epidemic came, it is quite natural that if my family member gets unwell, I'll take him to my family doctor in a corner nursing home or corner street. I won't directly jump into Breach Candy or Bombay Hospital. And suddenly that man may die in that small nursing home also. And unless the reporting happens to the EPID cell of the BMC with a 70-page case file, the death cannot be declared. So it was my hunch that this is happening all over. So I gave ultimatum to all the doctors in writing, all the hospitals, sorry. I said, in 48 hours, you must come clean. And whatever deaths you have not declared, because I have a zero pendency of declaration in BMC, but those not reported, please let me know. And 862 deaths were reported in 4 days of March, April, May. And that is how my MCGM's mortality rate jumped from 2.9 to almost 6%. And this exercise is not happening in the rest of the country. I can tell you, because I say everything from my heart. Because either the rest of the country should say that there was no home death anywhere in the country. There was no death on way before the patient reached the hospital because they have no case papers. Or they should come out clean. And this is the reason why continuously we're struggling. Now from that 6%, we have come to 5.7%. But in the last 25 days of July, my mortality is now 3.54. We're coming down. And second reason is that Mumbai is just not MCGM. Mumbai is MMR also. And if Mumbai has a population of 2 crores, even MMR is equally 2 crores. Starting from Panvel to Ulasnagar, Bhiwandi, Ambernath, Kalyan, Navi Mumbai, Thane, Mira Bhayandar, Vasai, Virar, Nalasupar. So this is another 2 crores. So it has got a mushroom of small clinics and nursing homes. So whenever somebody gets serious, they simply put him in ambulance and drop us here in PM or Sion or Nayak. And we cannot say no to them. You'll be surprised that thousands of such people have passed away in my hospitals. And now in COVID, we cannot hand over the dead body to be taken back to their native place, which is maybe Ambernath or Kalyan. We cremate that in our own crematoriums. MCGM has got 47 crematoriums. So, since all these extra burden also gets cremated in our place, and as per the law of registration of births and deaths, a person's death certificate has to be issued from the place where the person has died. So I may have around 4,000 people who came to Mumbai and died here in critical conditions. And they were brought here when they were in the last stage. And like for example, Sion Hospital, one of our flagship hospitals, 54% total deaths in Sion hospitals are non-MCGM area. And they were all cremated in Mumbai. So, and when people gather these data from crematoriums, and because our death register is made from crematoriums, they suddenly flash that Mumbai, thousands of more people have died. And we cannot avoid that because death certificate we have to issue. We have to cremate them. So this is another reason why there's a lot of confusion going on. But in the last, say, 25 days, after we started mission Save Human Lives, and I appeal to doctors in repeated meetings that every patient lying on your hospital bed, unless it is treated as your own brother or sister or husband or wife or mother or father, this mortality rate will not improve. And or simply if every evening you report that there are 50 dead bodies have come and they are in the mortuary, and you do a bureaucratic reporting every evening, then this mortality will keep on happening. But the moment you realize the amount of anxiety, the amount of care, amount of seriousness you give for your own husband, wife, mother, father, brother, sister, daughter, son, if every doctor starts behaving that way, this mortality is going to vanish. So that has a lot of positive impact. That initially we had almost 9% mortality in April. We are slowly coming down. Had I not declared those 862 home deaths and deaths which happened before they could reach hospital, I would have been around 2% today. But still we are working on that. There can be no excuse for mortality. And I can assure you that in another month's time, by 15th of August, our figures will further improve.
I think wonderfully said, sir. Wonderfully said. Two small questions are coming in very often. Now, one is that what were your experiences with nursing staff, because they're the backbone of every hospital, and how did you manage your dialogues with the private hospitals, major private hospitals?
Yeah, first nurses. There was a lot of pressure on nurses because of tremendous demand of beds and limited supply. let me mention that when I took over, we had only 3,700 beds in hospitals with us. And today, not only we have 16,800 beds, fully equipped with doctors, nurses, ward boys, functional. We have another 7,000 beds which can be made functional immediately. They are lying ready in jumbo facilities. So we have moved from 3,700 to 23,000 beds. And today, if you include those beds, 14,000 beds in hospitals are lying vacant. 14,000. And how much is the occupancy today? Just 6,000 beds. And another 3,000 we can activate. So this sea change has happened. But that time, since there was so much pressure on nurses, I immediately took a decision within 7 days of my joining. Dr. Lahane used to be my dean of JJ when I was secretary medical education. So I have excellent rapport with him. So I always treat doctors as my seniors. As an IAS officer, I always say they have rich experience, and there's nowhere you should say that they're under you. They are your colleagues. They are, in fact, you respect them because they are doing a great job. That is my approach to all the doctors. Like, I have never addressed Lahane without saying sir to him in the last 15 years since I know him. Whether even I was his boss, doesn't matter, because he is doing a great job, and it is they who are at the cutting edge level, and they are delivering. So Dr. Lahane advised me, sir, let us take out the second year, third year girls in nursing institutes, give them full salary of 30,000 rupees a month, and start deploying them. So we got suddenly 650 nurses from our own BMC nursing institutes. And when they came to the rescue of the existing nurses, suddenly, like, there was a lot of relief in the nursing sector. And even the girls were very happy, because being a student of second or third year, if they're getting a salary of 20,000 rupees, 30,000 rupees, so second year, third year respectively, they started working happily. So that is how we gave a lot of ease factor to the nursing staff by multiplying their availability. And what was the second question you asked, Dr. Harish?
You're muted, Dr. Harish Shetty. You're muted.
How did you manage the conversations with the private hospitals? And
Yeah.
Yeah.
Very good. In fact, the school of thought, that time we entered into the agreement on 25th of May, and 22nd we had decided upon that. From 9th or 10th of May, or before I joined, the thought was to take over these hospitals and put administrators. And one section in the government wanted that we must have an IAS officer to manage each of these 35 major hospitals. Because we have 350 IAS officers sitting home without any work for the last so many months. Only about 50, 60 were working. So more than 300 were sitting home. The idea was to put one IAS officer in every hospital. And he will take over the hospital, run the hospital. I was strongly opposed to that. I told the Honorable Chief Secretary Ajay Mehta sir that time, I said, sir, an IAS officer can do nothing. Tomorrow, if you put an IAS officer in a beach candy and there's nobody else there, all the doctors go and leave, what will the IAS officer do there? So it is a very bad idea to take over, to put an IAS officer and say that he's the boss there and now he'll run the hospital. So I tooth and nail, I opposed that. I said, let us rope them in, and let us convince them in a series of meetings. So we had almost 5 meetings with them, and in one of the meetings that early morning, there was a news item in New York Times. This was on, I would say, this was something 17th or 18th of May. I took a cutting from that and read that cutting in front of them. All the CEOs of this private hospital were there. It was mentioned that in Mumbai, the hospitals are collapsing. The medical sector, health infrastructure sector has crumbled, and patients are likely to die on the roads of Mumbai now. So I told these CEOs of these top 35 hospitals, most of them were there. I said, look, you had mega plans of medical tourism. You had mega plans that you will attract entire Middle East and make Mumbai as the hub of medical care. And for the next 10, 15 years, you will have major revenues coming from this sector of medical tourism. And look at we have just a few thousand patients, and you all collapsed. I said, this news items like this, they will spoil your reputation so much that you will have to forget about your medical tourism and future plans. I said, in your own interest of reviving your reputation, that you can deliver, and secondly, we all of us must join hands in the service to humanity. It is abnormal time, and there has to be an abnormal solution for this. And what the solution is? 4,000 rupees for a COVID bed, 7,000 rupees for an ICU bed, oxygen bed, and 9,000 rupees for an oxygen bed. And this is what you have to charge, whether you are Beach Candy, whether you are Nanavati, whether you are Leelavati. I said, and it is a matter of just 90 days. It is not for lifelong. So we said, let us enter into agreement from 1st of June to 31st of August. In these 3 months, if you even suffer losses, but if you serve humanity and save hundreds of lives, you should be mentally and psychologically very happy lot. And plus, our reputation will get protected. And the moment this pandemic is over, after a couple of months, your medical tourism thing will become reality. And you will, for the next 10 years, you guys will get so many patients from all over the world. The world will say that Mumbai is capable of handling medical sector, and they are well equipped. I said, you, for your own reputation, if you join hands with me, it will be wonderful. And that is how they agreed to whatever I told them later on.
Great.
And
You are a must.
everything happened by mutual consent. No order passed. No, there was no show cause notice issued. Till today, no show cause notice are issued. Everything happened by mutual understanding and their mutual consent.
So you are a master at everything. How do you view the future of Mumbai, sir? Do you really think we'll be able to unlock? What is your art of unlocking? Do you really think that we will come back to some form of normalcy? Festivals are approaching. Next week we have Bakri Eid. A month from now we have Ganpati. A couple of months from now we have Navratri and Diwali. So the citizens of Mumbai are getting very anxious, and the uncertainty is right of killing them in the mind. The virus is more in the mind than in the body. So how do you view it as the chief of Mumbai? How do you view it? Where are we headed, sir?
Sir, let me say that when I joined, our doubling rate was 9 days, and today morning is 64 days. And places like Bandra, they have doubling rate of 135 days. And we like I earlier said, that we just need less than 200 beds a day to take care of COVID in Mumbai, in a population of 20 million. So we are so comfortable that that everything can be opened out according to me. But the issue is our MMR. MMR is another equal to crores. Now, their things are not so satisfactory as on today. We are getting a lot of cases. Like I must share with you that today, Mumbai has 22,000 active cases. Out of this so-called 107,000 cases, only 22,300 are active cases. Pune has 44,000 today, double of Mumbai active cases. And Thane district has 37,000 active cases, 15,000 more than us. Now, my worry is that these areas, if we open trains, if we open shopping malls, and we open everything, there's 2 crore people who are still not in the satisfactory zone. They will get into Mumbai in lakhs and lakhs every day, because trains start from Nalasopara and they start from Kalyan and Kasara. So our situation, the possibility of our situation going again bad cannot be ruled out. That is the only one concern we have. But I can assure you that the day MMR comes to our stage, what we are today, infection of almost 1.1% today, doubling rate of 64 days, only 200 beds required. If that situation comes, I'll be the first person to recommend to Honorable Chief Minister to open up everything. But we have to be careful till the MMR situation improves as a matter of abundant precaution.
Great, sir.
Fantastic. I would like to put a very sensitive question. I think this is the most sensitive question I've had today from the audience. Sir, Gaurangi Raut says that last week we wanted a bed to admit a COVID positive patient, as the patient needed hospital admission. He stays in a 1 BHK with 1 toilet bathroom, and to her surprise, she couldn't get bed in Borivali Kandivali area. All government centers are full, and inquired in Malad, they said 60,000 per day for special room. And so there are a lot of such questions. how should they redress their issue with respect to bed and the exorbitant cost some hospitals have been asking?
Very, very good question. In fact, even it pains me when I get such feedback that despite 7,100 functional beds, despite 214 ICU beds with ventilator lying idle and vacant today, and somebody says that bed is not available, I am the biggest person who feels bad about it. For that, I have come up with a new strategy 15 days back. And I have been using paid publicity to publicize this also. But unfortunately, these days in newspapers, many of the home deliveries are not there. It is not reaching out. And I will further pep up my effort. These jumbo facilities, 1,000 beds in Goregaon, Nesco, 2,000 beds in BKC, 1,000 beds in Mulund, 1,400 beds in Racecourse and Dome, 700 beds in Regent Kudas. This is about almost 5,000 plus beds. I have made walk-in entry there, walk-in admission. So through this medium also, I like to appeal to every citizen of Mumbai and every citizen of MMR also that if you are not finding bed, you would simply take a taxi or take an ambulance and walk into one of these facilities. If you are in the northern slums, northern wards of Mumbai, you go to Nesco, Goregaon. If you are in central area, you go to BKC. If you're in southern Mumbai, go to Nesco and Dome and Racecourse or Baikula, Regent Kudas. If you are in eastern suburbs, just walk into Mulund. No questions asked, no advance reservation required, and bed is ready waiting for you.
Great, absolutely great, sir. I think I completely agree with sir that it's very painful that some people don't get beds, and I think this is something which I would request Adriud to advertise this across. That you have the most transparent municipal commissioner on planet Earth. He believes in transparency. He believes in humanity. He has a human touch to him, and he believes in warmth. And he treats every citizen of the city as his own family member. So that is very truly unique. So, Mr. Chahal, we have a personal question for you, and I want to ask you this very personally. How do you cope up with your own stress? Because you're always smiling, always fit. I speak to Mr. Chahal sometimes at 6, 7 o'clock in the morning. I sometimes speak to him at 12 o'clock at midnight, and he's always full of positive energy. From where does this positivity and energy come to you, sir?
Sir, like I'm a very disciplined person. First of all, my father was an army officer, and he grooved this discipline into me. I can say that in last 31 years of my service, I have never been late for any meeting at any level. I don't remember one example, one instance where I was late for a meeting. And this is what my father taught me, that you have to be on time everywhere. Secondly, somehow I developed good habits of, I'm a yoga instructor. I have been running marathons for the last 20 years. I have run more than 60,000 kilometers. People say that you spoil your knees, but I am going on. Last Sunday, I did 21-kilometer marathon. Tomorrow again, I plan to do one. Then I'm a very good swimmer. I can swim hours and hours together. But last evening, I was telling Honorable Aditya Thackeray, sir, let us open swimming pools. I'm suffering. so I think these things contribute to all this.
Thank you, sir. Dr. Shetty?
I think, yeah. Absolutely. As we slowly come to a close, I'm very sorry for all the viewers that we'll take all your questions tomorrow as we meet. But one question for sir. Sir, मोटा मोटा बात, मुझे वो दूध तो आप बिल्कुल नहीं देंगे, छाछ भी नहीं देंगे और वो वाइट घी भी नहीं देंगे. आप हमें पूरे शहर को ऐसे कुछ मंत्र दीजिए by which people will get infected with the visionary zeal, with the missionary zeal which you have, and leading from front by meeting people eyeball to eyeball. I mean, that's a new sentence I've learned, which I'll use it in my talks, eyeball to eyeball. What are the things which a man on the street, a man in a jhuggi slum, a man in a small flat, or a man on a tower, should follow in the city of Bombay for the next 6 months? And also accompanied by that, sir, sorry to really go to your personal life. So I know you have everything to keep yourself fit, but do you get some source of inspiration from your family? How do they support you in this entire venture? They must be seeing you very rarely at home. So how do you cope with that too, sir?
When I joined 8th of May, I requested my wife and my 2 sons. I said, now tomorrow morning you must leave for Chandigarh, my hometown, and we will meet after 6 months. They were so cooperative that they left for Chandigarh, and I'm alone for the last since 9th of May, and that is how they have contributed.
Few tips for
and now your more important question regarding my appeal to citizens of Mumbai with very folded hands.
Yes, sir.
That for next 6 months, let there be no marshals. People tell me to put marshals. Let there be no policing. Every citizen, every respected citizen of Mumbai must make a promise to his own self that I have to save my own wife, husband, son, daughter, father, mother in that small flat or small house of mine by not me getting infected when I roam around. Because the moment I get virus home, I am going to spread it to all my members in few hours. For that, he must resolve that rather than a policeman asking him कि आपने mask नहीं लगाया हुआ, he should not be without a mask, and he should be using sanitizer. He should maintain social distancing. If he's visiting chemist shop, other day I went to a chemist shop to buy a medicine. One person just came and stood on my shoulder. So I told him, I said, please keep 1 meter away. He was very angry. He said, ऐसे कैसे बोल रहे हो आप मुझे? So this has to change. He has to understand that I may give virus to him. He should keep 1 meter away from me rather than coming on my shoulder. So social discipline, social distancing, physical distancing, wearing mask 100% the moment you step out of the flat. Even if you're living in a gated community, you have own jogging parks and park within your society. You should not step out of your flat without a mask. This is what is happening in our high-rise buildings. Today, this 1,000 list which has come today, 80% cases are from buildings. Only 20% cases are from slums. It is embarrassment that slum people are showing us the way and we are not able to follow that. 80% cases today, if the high-rise buildings behave properly, our cases from slums only 200 out of the 1,000 list. Look at the contribution of our slum dwellers and look at their discipline that they are following, and look at the comparison with our high-rise dwellers that they're generating 80% positive cases today. So wearing a mask within your society, don't stepping out of your door of your house without a mask, using sanitizer, you following, if you're going to an office, you're in a bus stand, you're in a railway station, whether you are everywhere, you should maintain a social distance automatically. Rather than policemen coming to you and asking कि आपने mask नहीं पहना हुआ, आपको fine कर रहे हैं, or rather than somebody pointing out कि जरा थोड़ा आप distance maintain करिए. Every citizen must do of his own. This is my humble appeal with folded hands.
Thank you, sir. Thank you, sir, so much. You are a person with army lineage, which is genetic. You are a person with strong discipline and strong roots, highly intellectual. You have been a merit rank holder of CBSE, and you have a human touch and a human heart. Sir, Mumbai is blessed to have you. Please keep on doing your good work. And we are very grateful that you joined on our show. Thank you so much. And
thank you very much, sir. Thank you very much. I'm so grateful to you for giving this opportunity.
And also, sir, we learned a lot. Eyeball to eyeball confrontation, meeting people live, inspiring them, and playing the entire match on the front foot. I loved what you said, that when you went on the field, hundreds of assistant commissioners, all and the entire staff was spurred to work. I think with this, we will definitely win the battle of COVID in Bombay. With this, thank you, sir. Thanks.